All right, hey everybody, Kingfisher Dentistry and Braces, Dr. Bowman, Dr. Barnett. Just wanted to pipe in real quick. If you watch the news at all, you've been hearing about the cavity laser they're talking about on the news on Channel 4. One of the things that we wanted to let you know is here in Kingfisher, we actually have that laser here in the office. We were one of the first offices in the state of Oklahoma to have this technology. I think from my understanding right now, we're the only office in Northwest Oklahoma to even have this technology. It's very, very advanced technology in which we can go in and actually take care of cavities and many procedures without even having to numb patients.
Yeah, there's a lot of cool things you can do with it. One of the biggest advantages that people will talk about is that it's anesthesia-free. We can do fillings without having to give anesthesia, no shots. It's antibacterial, so anything that we're doing, any procedure we're doing, it will kill any bacteria in the area. We can work on hard tissue like bone, teeth. We can work on soft tissue like gums, lips, cheeks, the inside of the mouth. We can relieve a lot of tongue ties, lip ties, gum surgeries, cavities, fillings, all that we can do with this laser. It's really incredible what we can do with it.
One of the things that I really liked, I had a patient that came in the other day and they had a cavity that was really bad and it was close to having to be a root canal. And one of the things we were able to do is we were able to turn the power of the laser down so that all it does is take away any part of diseased tooth. And because it does that, it goes in and actually glazes over the tooth and just sits there and destroys the bacteria that's there. We didn't end up having to do a root canal. We did a crown on the patient, called the patient that night. The patient was having zero pain, none whatsoever. And it was one of those ones that was a borderline, ooh, we may have to do a root canal. But because of the technology that we were able to have, we were able to treat the patient in a way that's superior than what we used to be able to do. And that's all because of the investment we've made in this laser right here.
Another benefit too is some other things I'm going to do is relieve some tongue ties on small children, even babies. And in the past, those procedures were done with metal instruments where you have to cut tissue. I was able to do this, same thing, relieve the tongue ties. There was zero bleeding whatsoever. Babies were able to be, moms were able to feed and nurse the babies right away. So really beneficial in that way.
We just wanted to kind of show you a little bit, just a minor thing about kind of what the laser is like. So we can adjust the power on the laser and how it works. And so I'm just going to kind of show you. I've got the power of the laser turned way down. I can adjust it for tissue or for if we're doing bone. But look at this. I can even go and it's sitting there. See how it's sitting there moving around? It's actually, the laser is being ejected onto my hand. You can see the little lines that it made on my hand, but it's no pain whatsoever. You see those lines?
Yeah.
No pain whatsoever. And so we're able to adjust the power of the laser to what it is that we need to be doing. If it's tissue that we're going in and relieving, or that we're going to be doing a procedure with just the tissue, or even a point where I had a patient in, had a lot of growth from their braces and their gums were overgrown. We were able to take the laser, contour the tissue, cut back some of that extra tissue that has grown in there. The patient wasn't even numb for it, and it just completely healed the just necrosed, gross tissue that was there. So great technology.
Very much.
Come see us. We love what we do. Great technology. This is just one of the many pieces of technology that we've invested here for our patients, because we love being able to provide the best care possible in all of Northwest Oklahoma.
If you have questions, just come ask us.